A tycoon drinks bottled sunshine from a brown glass bottle, and 3 years later his jaw comes off in his surgeon's hands, piece by piece, until there is nothing left of his upper skull to remove. A respected neurologist drives a steel pick through a patient's eye socket, taps it with a mallet until it sinks 2 inches into living brain tissue, and gets a standing ovation from the medical establishment for it. A children's cough remedy made from heroin goes on sale from a company whose aspirin you probably have in your cabinet right now, marketed with a smiling illustration on the box. 31 real moments when the most trusted people in medicine looked at a suffering body and, with total confidence, made it worse. These are not jokes. Every single one of them actually happened, documented in hospital ledgers, court transcripts, and newspaper obituaries that never once used the word mistake. Power does not cancel stupidity. Neither does a medical degree. Number 1. For roughly 400 years, European and American doctors treated syphilis with mercury, not as a folk remedy on the margins, as first-line, mainstream, university-taught medicine. Physicians rubbed mercury ointment into the skin, had patients inhale mercury vapor in sealed steam cabinets, and prescribed mercury pills by the dozen, all based on the old alchemical idea that a metal linked to the god Mercury could burn out a disease linked to Venus. The saying at the time was blunt: a night with Venus, a lifetime with Mercury. The first dose brought a metallic taste and swollen gums. Doctors called that progress, since the drooling meant the treatment was working. So they raised the dose. Teeth loosened, then fell out. Gums turned black and rotted. Patients developed tremors so severe they were mistaken for a separate nervous disorder, a shaking so recognizable that mad as a hatter. Coined for felt makers who breathed the same vapor daily, could just as easily have described a syphilis patient mid-course. Physicians raised the dose again because a disease this stubborn clearly needed more of the medicine that was steadily poisoning the person carrying it. Some patients underwent mercury treatment for years on end, cycling through steam cabinets every few months, their gums re-blackening each time before they'd fully healed from the last round. Mercury treatment for syphilis did not end because someone proved it worthless. It ended in 1910 when a genuinely better option, arsenic-based salvarsan, finally arrived. 4 centuries of confident dosing, and the disease was never the only thing killing the patient. 2. December 14th, 1799, Mount Vernon, Virginia. George Washington wakes with a sore throat and labored breathing, almost certainly a bacterial infection closing his airway. His physicians, led by Dr. James Craik, know exactly what to do: drain the bad blood out of him. That was the first mistake. Over roughly 10 hours, 3 doctors bled Washington 4 separate times, pulling an estimated 5 pints, close to 40% of his total blood volume, from a 67-year-old man already struggling to breathe. That was the second mistake. Between bleedings, they blistered his throat with a compound designed to raise painful skin welts, on the theory that drawing irritation to the surface would pull the disease out with it. That was the third. Then they dosed him with calomel, a mercury-based purgative, to empty his bowels on top of everything else his body was fighting to survive. Washington reportedly asked his doctors, at one point, whether he might simply be let go, telling them he did not fear death but felt he had a long fight and would not survive it. His voice grew fainter with every hour. One physician on the scene, Dr. Elisha Dick, was the lone dissenting voice. He suggested a tracheotomy to open the airway directly, arguing that bleeding a man this depleted any further could kill him outright. He was overruled by the more senior doctors, who preferred to keep bleeding him, trusting decades of training over one colleague's untested instinct. Washington died that night, roughly 10 hours after his symptoms began. His last recorded instructions to his staff concerned his own burial. The most powerful man in the country still could not outrank his own doctor's confidence in a lancet. 3. Bloodletting had a partner in crime, and its name was calomel, mercurous chloride, swallowed as a purgative. In Philadelphia's yellow fever epidemic of 1793, physician Benjamin Rush championed what he called heroic medicine. If a small dose helped a little, a massive dose should help a lot. Rush prescribed calomel in quantities 10 to 20 times what earlier physicians had considered safe, paired with aggressive bleeding, on thousands of patients during the outbreak. What could possibly go wrong? Patients who survived the fever were left with the classic signature of mercury poisoning: teeth falling from blackened gums, jawbones eaten away by a condition doctors nicknamed mercurial gangrene. The compound was pressed into pill form as blue mass and stayed in mainstream American medicine chests for the better part of a century, prescribed for everything from constipation to melancholy to teething pain in infants. Abraham Lincoln reportedly took blue mass pills for years before quietly stopping, worried about his temper, telling associates the fits of irritability he'd noticed in himself seemed to track the pills almost exactly. The dose that was supposed to prove the treatment's strength was, the whole time, the thing doing the damage. 4. In 18th century London, the Royal Humane Society, founded in 1774 specifically to revive drowning victims pulled from the Thames, issued rescue stations along the riverbank stocked with a very specific device, a tobacco smoke enema kit. The theory was sound enough on paper. Warmth and stimulation might restart a stalled heart, and tobacco smoke, blown up through a rectal tube via a fireside bellows, was believed to deliver exactly that kind of jolt. Rescuers would kneel over a pulled from the river body and pump smoke in with real urgency, convinced they were doing the most modern, most scientific thing available, sometimes working the bellows for a full quarter hour before giving up on a patient. The technique spread across Europe and into general medical use for shock, hernias, and even cholera, decades after the drowning rescue use began. Then, in 1811, physiologist Benjamin Brodie ran the actual physiology and found nicotine wasn't a stimulant to a struggling heart at all. It was a depressant, capable of stopping one that was already faltering. Brodie's own experiments, applying tobacco smoke to test animals, showed hearts slowing and stopping under exactly the treatment London's rescuers had spent decades administering to half-drowned Londoners in good faith. The very method sold as a life-saving jolt could tip a fragile patient the rest of the way into cardiac arrest. The phrase surviving from this era, still used today for skepticism about false reassurance, is not subtle about where it came from. There's a case from 1782, preserved in the Royal Humane Society's own annual report, of a boatman pulled from the river, apparently lifeless, worked on for nearly 20 minutes by two rescuers taking turns at the bellows. He was recorded as revived, and the society cited the case for years afterward as proof the method worked. Nobody at the time thought to ask how many quieter, unrecorded cases on the same riverbank had gone the other way, because a technique that occasionally succeeded was, in that era, indistinguishable from a technique that worked. 5. By the 1870s, pale skin was fashionable, and Dr. James P. Campbell's arsenic complexion wafers promised it in wafer form. A small, sweet tablet women could eat daily for a clear, porcelain complexion. Arsenic did produce a visible effect. It dilated capillaries near the skin's surface, giving cheeks a temporary flush and a translucent look that Victorian beauty standards prized. Women who wanted more of that glow simply ate more wafers, some working their way up from one wafer a day to 3 or 4 within a season, exactly as the marketing implied was safe. Physicians prescribed a related formulation, Fowler's solution, potassium arsenite in water, as a general tonic for everything from anemia to asthma, often for months at a stretch. The arsenic accumulated. Patients developed hyperkeratosis, a thickening and darkening of the skin on the palms and soles, which is now recognized as one of the clearest markers of chronic arsenic poisoning. Decades later, some of the same patients developed skin and bladder cancers directly traceable to that complexion regimen. The wafers were marketed, sold, and swallowed for the better part of 50 years before the ingredient itself was finally treated as the poison it had always been. 6. At the 1904 St. Louis Olympics, marathon runner Thomas Hicks was flagging badly in the summer heat with several miles left to run. His trainers had a solution ready: a dose of strychnine sulfate mixed with egg whites and brandy, administered mid-race. Strychnine, in small quantities, was a legitimate stimulant tonic in that era's pharmacies. Sold in Victorian and Edwardian nerve tonic bottles for fatigue, weakness, even impotence. In a runner already collapsing from exhaustion and dehydration, it was something closer to a controlled overdose in progress. Bold strategy for a foot race. Hicks began hallucinating, his muscles seizing in ways that closely mirror strychnine convulsions, and had to be half carried across the finish line by his own handlers, his feet barely touching the track in the final stretch. He was declared the winner anyway. Doctors who examined him afterward said a second dose might well have killed him. Strychnine tonics stayed on pharmacy shelves for ordinary customers, sold as an energizing pick-me-up, for another 2 decades after an Olympic gold medalist nearly died from exactly that dose on camera, essentially in front of a stadium of witnesses. 7. In 18th and 19th century Britain, mothers working long factory shifts needed their infants to stay quiet and asleep for the day, and pharmacists had precisely the product: Godfrey's Cordial, a treacle-sweetened opium tincture marketed directly for teething pain and infant colic. What could possibly go wrong? A working mother, unaware of how much opium a small dose actually delivered to an infant's body weight, would give a spoonful before leaving for her shift and come home to find the baby had simply never woken up. Parliamentary investigations in the 1860s documented what came to be called infant doping as a recognized and widespread cause of infant death, concentrated specifically in industrial towns where mothers had no childcare alternative. One coroner in a Lancashire mill town testified that he had recorded more infant deaths attributable to soothing syrups in a single year than to any other single cause on his docket, including disease. Physicians of the era rarely intervened, since the cordial was sold over the counter, marketed as gentle, and doctors themselves sometimes recommended it for a fussy child. The parents wanted quiet children. The remedy sold to them delivered exactly that kind of quiet, permanently, in an unknown number of homes that were never counted. 8. America had its own version, launched in 1849, Mrs. Winslow's Soothing Syrup, a morphine sulfate preparation marketed with a warm illustration of a mother and sleeping infant on the label. The product became one of the best-selling patent medicines in the country, advertised in newspapers coast to coast as a gentle, motherly solution for teething and fussiness. Parents dosed their children by the spoonful, exactly as directed, with no way of knowing the actual morphine concentration varied between batches. One bottle might be mild, the next noticeably stronger, with nothing on the label to warn them either way. Infants who received a slightly stronger batch, or a second dose before the first had worn off, simply stopped breathing in their sleep. Case records from the period describe mothers discovering their child unresponsive in the morning and, in some documented instances, reaching for the same bottle again days later for a younger sibling, having no reason yet to suspect the syrup itself. By 1911, the American Medical Association had publicly labeled it one of the deadliest patent medicines sold in the United States, blamed for an unknown number of infant deaths spanning 6 decades of continuous, legal, respectable sale. The label never changed. The warm illustration of the sleeping baby stayed exactly the same, right up until it went off the market. 9. In 1885, the Lloyd Manufacturing Company began selling cocaine toothache drops, marketed with the confident promise of an instantaneous cure for children's dental pain. The advertisement showed two happy children, and the pitch was straightforward. Dab the tincture onto the aching tooth, and the pain vanishes. It worked in the narrowest sense. Cocaine is an effective local anesthetic, and children did stop crying almost immediately. What the label never mentioned was that the numbing didn't stay local. Absorbed through the gums, repeated doses built tolerance and dependency in developing bodies that had no business processing a stimulant narcotic in the first place. The product sold freely, without a prescription, for nearly 3 decades before the Harrison Narcotics Tax Act of 1914 finally restricted it. An entire generation of American children was introduced to cocaine by their own worried parents, following the instructions printed directly on the bottle. 10. In 1898, the German pharmaceutical firm Bayer, the same company whose aspirin sits in your medicine cabinet today, launched a new cough suppressant developed by chemist Heinrich Draeser. Bayer marketed it under the trade name heroin, derived from the German word for heroic, and promoted it as a safer, non-addictive alternative to morphine, suitable even for children's cough remedies. It was sold over the counter, in cough syrups and lozenges, across Europe and the United States for over a decade, stocked on the same shelf as ordinary household cold remedies. Patients using it for a persistent cough found their cough eased. They also found they wanted the next dose sooner than they should have, and then sooner still. Bayer's own internal enthusiasm for the non-addictive claim survived roughly a decade before addiction rates made the truth impossible to ignore, and restrictions began rolling in through the 1910s and 1920s. The company that built its reputation on aspirin spent the earlier part of that same decade selling one of the most addictive substances in medical history as a children's remedy, under a name that still, unbelievably, means heroic. 11. In the early 1900s, a clinic in Freiburg, Germany, run by Dr. Karl Gauss, began offering laboring women a combination of scopolamine and morphine, marketed as twilight sleep, a state that didn't eliminate labor pain so much as it eliminated the woman's memory of it afterward. American journalists Marguerite Tracy and Constance Loop popularized the method in the United States around 1914, and it swept through fashionable maternity wards as the modern, humane, scientific way to give birth. Mothers under twilight sleep often had to be restrained, sometimes in padded rooms with the windows covered and their wrists strapped to the bed frame, thrashing and screaming through labor they would recall nothing of once it ended. Scopolamine is a delirium-inducing drug, not a sedative in the way patients believed. Some mothers, and some infants exposed to morphine crossing the placenta, suffered respiratory depression severe enough to be fatal. The method stayed fashionable in maternity wards for decades, marketed the entire time as gentler than what came before it, to women who would never remember whether that was actually true. 12. In 1909, chemist Paul Ehrlich and his collaborator Sahakiro Hata developed arsphenamine, compound 606, marketed as Salvarsan, and the press hailed it as the first true magic bullet in medicine, a manufactured chemical that could target and destroy a specific disease-causing organism, syphilis, without simply poisoning the whole patient in the process. It was genuinely a landmark. It was also an arsenic compound with an extremely narrow window between a therapeutic dose and a toxic one, requiring exact preparation and administration that many physicians of the era simply weren't equipped to get right. Improperly mixed or improperly dosed batches caused arsenic poisoning in patients who'd been told they were receiving the safest treatment medicine had ever produced. Scandals over inconsistent dosing and adulterated supplies followed Salvarsan for years, and the controversy became one of the direct pressures behind early drug standardization laws. The first modern wonder drug arrived, and immediately needed the same kind of oversight as every poison that came before it. 13. In 1925, William J. Bailey, a man with no medical degree who nonetheless carried himself with total clinical authority, began selling Radithor, distilled water infused with radium, bottled and marketed as a tonic for restoring vitality, curing impotence, and treating mental impairment. Radium had genuine scientific glamour at the time. The Curies had won a Nobel Prize for isolating it barely 2 decades earlier, and Bailey leaned hard on that borrowed credibility. Pittsburgh industrialist and champion golfer Eben Byers began drinking it in 1927 on his doctor's suggestion for a nagging arm injury and liked the pep it seemed to give him. He kept going. By some estimates, he drank close to 1,400 bottles over roughly 3 years, sending crates of it to friends and even his racehorses as a gift, convinced he'd found the secret to boundless energy. That sounds fake, even when it is completely real. His jawbone began to disintegrate. Holes opened in his skull. By 1932, most of his jaw had literally been removed in surgery, piece by piece, and he died that year from radium-induced cancer, his body reportedly so radioactive that he was buried in a lead-lined coffin. The Wall Street Journal's headline on his death remains one of the most quoted lines in the history of quack medicine. The radium water worked fine until his jaw came off. 14. Radium's glow wasn't only sold to drink, it was sold to paint with. Starting in 1917, the U.S. Radium Corporation in Orange, New Jersey, employed young women to hand paint luminous numbers onto watch and instrument dials using radium-laced paint, and instructed them to keep their brush tips fine by pointing them between their lips. Management assured the women the paint was completely harmless. Safe enough, supervisors said, that they wore lead aprons themselves while handling the same material at a distance. The women, sometimes for fun, painted their nails and teeth with the glowing radium paint to surprise their boyfriends after dark, walking home from the factory lit faintly from the inside like something out of a fairy tale. Within a few years, workers began developing what came to be known as radium jaw. Bone, death, and disintegration exactly like Eben Byers would suffer a decade later, along with severe anemia and bone cancers. Grace Fryer and 4 other dial painters filed suit in 1927, forcing the company's hand in a case that became a landmark for occupational disease law. The company's own defense, for years, was that any workplace this modern couldn't possibly be the problem. 15. Between the 1930s and 1950s, radiologists across the world adopted Thurotrast, a thorium dioxide suspension. As a contrast, dye, injected into patients to make blood vessels and internal organs show up clearly on X-rays. It worked beautifully in the moment, producing crisp, detailed images that made diagnosis dramatically easier. The catch, invisible on any single X-ray, was that thorium is radioactive, with a half-life measured in billions of years, and once injected it lodged permanently in the liver, spleen, and bone marrow, irradiating those organs from the inside for the rest of the patient's life. Decades later, sometimes 20, 30 years after a single injection, Thurotrast patients began developing rare liver cancers at rates far above the general population, along with leukemias traceable directly back to that one clear, crisp scan from decades earlier. Most countries didn't restrict it until the 1950s or later. The contrast dye had done exactly what it promised. It had also quietly started a cancer clock that wouldn't finish ringing for another generation. 16. In 1937, a chemist at the S.E. Massengill Company named Harold Watkins needed to turn the new antibacterial drug sulfanilamide into a liquid so it could be given easily to children. He dissolved it in diethylene glycol, a sweet-tasting industrial solvent chemically close to antifreeze, because it worked as a solvent and nobody at the company tested it for toxicity first. That was the first failure. The product, elixir sulfanilamide, shipped nationwide with no warning label because federal law at the time didn't require safety testing before a new drug went to market. That was the second. It reached pharmacy shelves and doctors' offices across the country before anyone realized the solvent itself was lethal. Patients. A significant number of them, children treated for routine infections, began dying in agony from kidney failure within days of taking the medicine. Over 100 people died before the company managed to recall what it could. Watkins, by most accounts devastated, took his own life before facing trial. One of the mothers, a Tulsa woman named Joan Marlar, whose 6-year-old daughter had died after taking the elixir for a sore throat, wrote directly to President Roosevelt, describing the child's final days in plain, unbearable detail. The seizures, the swelling, the hours of pain that no dose of anything the doctors tried could touch. Her letter circulated through Congress during the hearings that followed and is credited by historians as one of the documents that turned a regulatory footnote into a genuine national scandal. The disaster became the direct reason Congress passed the Federal Food, Drug, and Cosmetic Act the following year, finally requiring that new drugs be proven safe before they could be sold to the public. It took roughly 100 bodies and at least one mother's letter that Congress couldn't look away from to make that requirement obvious. 17. By the 1930s, Lysol, a household disinfectant not remotely designed for internal use, had developed an entirely separate, unofficial reputation among American women as a contraceptive douche. Advertisements leaned into euphemism, showing anxious wives and promising feminine hygiene solutions without ever quite saying what the product was actually being used for, while quietly implying it prevented pregnancy. Doctors of the era, uncomfortable openly discussing contraception, sometimes let the euphemism stand rather than correct it. Women used it exactly as the ads implied, at concentrations the label never anticipated for that purpose. Case reports collected in public health journals through the decade documented chemical burns, severe internal irritation, and a number of confirmed poisoning deaths tied directly to Lysol douching. The company that made a bathroom cleaner became, unofficially, and with no clinical basis whatsoever, one of the most widely used birth control methods in America for over a decade. 18. From the 1920s through the 1950s, shoe stores across the United States and Britain installed a genuinely popular in-store attraction, the X-ray shoe-fitting fluoroscope. A customer would slide their feet into the machine, look through a viewing port, and see a live X-ray image of the bones inside their new shoes, supposedly to confirm a perfect fit. Children loved it, sometimes climbing back onto the machine 2 or 3 times in a single shopping trip just to see their own toe bones glow green again. Sales clerks, standing beside the machine dozens of times a day to help customers position their feet, absorbed far more cumulative radiation than any single customer ever did. The machines had no meaningful shielding and no dosimetry. Nobody was tracking how much radiation anyone actually received, clerk or customer. It took decades, well into the 1950s and in some places the 1970s, before radiation safety research caught up to a device that had spent 30 years treating repeated, unmonitored X-ray exposure as a fun in-store perk for buying shoes. 19. In 1927, Viennese physician Manfred Sauckel introduced insulin coma therapy for schizophrenia, deliberately overdosing patients on insulin to induce a hypoglycemic coma, on the theory that the shock to the brain would reset psychiatric symptoms. Hospitals adopted it enthusiastically, and it became standard psychiatric practice across Europe and America for the next 3 decades. The procedure required a full medical team on standby for every session, ready to pull a patient back from the coma with a glucose injection at precisely the right moment, because push the coma even slightly too far, and the patient didn't wake up at all. Nurses on insulin coma wards described the tension of those sessions decades later as some of the worst hours of their careers, watching a clock and a patient's face at the same time, knowing a few minutes' delay in the glucose line was the difference between a treatment and a death. Mortality estimates from the therapy ran around 1 to 2% per full course of treatment, a death rate psychiatric hospitals accepted as the ordinary cost of doing business for decades. It remained standard care into the 1960s and 1970s in some institutions, discontinued only once genuinely effective antipsychotic medication finally gave doctors something safer to reach for instead. 20. In 1934, Hungarian psychiatrist Ladislas Meduna proposed a related theory, that inducing a violent seizure in psychiatric patients could interrupt schizophrenia, and he began injecting patients with a stimulant drug called metrazol to trigger one on demand. Unlike a coma, which crept in slowly, a metrazol seizure hit almost instantly and with tremendous physical force. Patients reported a wave of pure terror in the seconds before convulsing, a sensation many later described as worse than any symptom the treatment was supposed to fix, followed by convulsions violent enough to fracture vertebrae and crack teeth. Some hospitals began strapping patients to the treatment table specifically to prevent the fractures the seizures themselves were causing, treating broken bones as an acceptable side effect of a procedure meant to help. Hospitals kept using it anyway because the seizure, brutal as it was, did sometimes produce a temporary lull in psychiatric symptoms afterward. It was eventually phased out in favor of electroconvulsive therapy, which produced a controlled seizure without the several seconds of documented, unmedicated dread beforehand. Progress, in this particular corner of medicine, meant choosing which specific horror the patient would be subjected to next. 21. In 1935, Portuguese neurologist Antonio Egas Moniz developed the prefrontal leucotomy, severing connections in the brain's frontal lobe to treat severe mental illness. In 1949, the Nobel Committee awarded him the prize in physiology or medicine for it. Sweden gave that man a medal. In the United States, physician Walter Freeman took the idea and made it faster, cheaper, and far more casual. The transorbital lobotomy, performed by tapping a surgical instrument, modeled directly on an ice pick, because an actual ice pick from his own kitchen was his original prototype, through the thin bone above each eye socket, using only electroshock as anesthesia. That was the first shortcut. Freeman performed the procedure in his office, sometimes for a handful of minutes per patient, and eventually took a station wagon he nicknamed the Lobotomobile on cross-country tours performing lobotomies in state hospitals, sometimes on dozens of patients in a single day. That was the second. He rarely wore surgical gloves. Roughly 40,000 lobotomies were performed in the United States alone before the practice fell out of favor, including on Rosemary Kennedy in 1941, a 23-year-old left permanently and severely incapacitated by a procedure her own family had approved as a treatment for mood swings. Her family, by most accounts, was not told beforehand how experimental the procedure still was, or how little Freeman and his partner could predict its outcome in any individual patient. Rosemary spent the rest of her life, more than 6 decades, in institutional care as a direct result of an afternoon's work. Moniz wanted a targeted cure for suffering. Instead, an entire generation of patients lost the parts of themselves that made the suffering theirs to have in the first place. 22. Starting in the 1940s, doctors began prescribing diethylstilbestrol, a synthetic estrogen known as DES, to pregnant women believed to be at risk of miscarriage, based on early studies that seemed to show it helped sustain a pregnancy. Physicians recommended it routinely and confidently for decades. Some doctors gave it to any pregnant patient who asked, treating it as harmless insurance. Later, more rigorous research found DES did nothing to prevent miscarriage at all. Worse than useless, it turned out to be actively dangerous. Daughters born to mothers who'd taken DS began, years later, developing a rare vaginal and cervical cancer called clear cell adenocarcinoma at rates far above normal, along with reproductive tract abnormalities that surfaced only once those daughters reached adulthood and tried to have children of their own. Somewhere between 5 and 10 million pregnant women in the United States were prescribed the drug before it was finally withdrawn for pregnancy use in 1971. The damage, in most cases, wasn't visible until an entire generation later. 23. In 1957, the West German pharmaceutical company Chemie Grünenthal launched thalidomide, marketed as an exceptionally safe sedative and anti-nausea treatment, ideal for pregnant women suffering morning sickness. It was sold over the counter in West Germany without a prescription, and doctors across Europe, Canada, and dozens of other countries recommended it with real enthusiasm. Testing on pregnant animals hadn't been standard practice, so nobody had specifically checked what it did to a developing fetus. What it did was interfere with limb development during a critical early window of pregnancy. An estimated 10 to 20,000 babies worldwide were born with severe limb malformations, most commonly shortened or absent arms and legs, before German ophthalmologist Wedekind Lenz and Australian physician William McBride independently traced the pattern back to the drug in 1961. In the United States, the disaster largely didn't happen. FDA reviewer Francis Kelsey refused to approve the drug repeatedly over direct pressure from the manufacturer on the simple grounds that the safety data wasn't good enough. She was, by her own later account, called overly cautious and difficult by company representatives who visited her office more than once to push the application through faster. One regulator's stubbornness against her own agency's confidence in the obviously safe cure is the reason an entire country's worth of children were spared what an entire continent's worth were not. 24. Chalmugra oil, drawn from the seeds of a tree used for centuries in Ayurvedic and traditional Chinese medicine, became the Western medical establishment's primary treatment for leprosy by the early 20th century. Doctors at leprosaria, including Kalaupapa in Hawaii and Carville in Louisiana, administered it as a deep intramuscular injection on a strict, repeated schedule for years at a time. Patients uniformly described the injections as excruciating. The oil was thick, slow to absorb, and left painful lumps at the injection site that could persist for weeks. Effectiveness varied wildly from patient to patient, with no reliable way to predict who would improve and who would simply endure the pain for nothing. It remained the standard treatment for roughly 4 decades, prescribed with full institutional confidence, until sulfone drugs like dapsone arrived in the 1940s and finally gave leprosy patients something that worked without the agony baked into every single dose. 25. In 1954, a French pharmaceutical company began selling Stalinon, an anti-staphylococcal treatment containing diethyltin diiodide, an organotin compound with genuine antibacterial promise on paper. The manufacturing process, however, produced a batch with a far higher concentration of a related toxic tin compound than intended, and nobody caught the error before it reached pharmacies. Patients prescribed Stalinon for ordinary skin infections began developing severe cerebral edema, swelling inside the skull with no obvious external symptom until it was already dangerously advanced. Over 100 people died from a drug prescribed for conditions that, left alone, would almost certainly not have been fatal at all. The subsequent trial in Paris became a case study in how far a manufacturer could go in blaming everyone but itself. Company representatives argued in court that the fault lay entirely with a subcontracted chemist who had allegedly misjudged a formula ratio, while investigators presented internal batch records showing the company's own quality checks had flagged inconsistent readings on the very lot that killed people and had shipped it anyway. The scandal became one of the worst pharmaceutical disasters in French history and forced a significant tightening of French drug manufacturing oversight, a full generation before similar reforms took hold elsewhere in Europe. 26. Starting around 1917 in Milford, Kansas, a man calling himself Dr. John R. Brinkley, holding a medical license from a diploma mill, not an accredited institution, began offering a startling procedure, implanting goat testicle tissue into men complaining of impotence and declining vitality, promising restored virility and youthful energy. That sounds fake, even when it is completely real. Word spread, and Brinkley built an empire on it, eventually broadcasting his own radio station to advertise the procedure nationwide and running a genuinely competitive campaign for governor of Kansas in 1930, partly on the strength of his medical celebrity. Patients paid enormous sums for the implants. Many developed severe infections at the surgical site. A number died from complications directly tied to the procedure or its aftercare in an era with limited antibiotic options. It took the American Medical Association's editor, Morris Fishbein, running a sustained public campaign against him for over a decade before Kansas medical authorities finally revoked Brinkley's license in 1930. He wanted a fortune built on restored youth. Instead, he built one of the most brazen medical frauds of the 20th century and got a serious shot at the governor's office out of it anyway. 27. Ergot, a fungus that grows on rye and related grains, produces a set of alkaloid compounds that 19th and early 20th century physicians found genuinely useful. Medicinal ergot preparations helped control postpartum bleeding and treated migraine headaches with real effectiveness at the correct dose. Doctors leaned on it heavily, sometimes prescribing repeated doses for chronic, severe migraine sufferers over weeks or months. Ergot alkaloids, though, constrict blood vessels. That's precisely how they controlled bleeding, and sustained or excessive dosing could cut off circulation to the extremities badly enough to cause gangrene. Patients developed the condition doctors nicknamed St. Anthony's Fire. Burning pain in the hands and feet, followed in severe cases by tissue death requiring amputation, alongside convulsions in the worst affected. The same compound prescribed to fix one problem, dosed a little too generously or a little too often, was capable of quietly cutting off a patient's own blood supply from the inside. 28. Tartar emetic, potassium antimony tartrate, was the workhorse tool of what 18th and 19th century physicians proudly called heroic medicine, alongside bloodletting and calomel. The logic was consistent across all three. Illness was an imbalance, and a sufficiently forceful purge of blood, of bowels, or in this case of stomach contents through induced vomiting, would restore the body's balance by main force. Doctors prescribed it for fevers, for melancholy, for chest infections, for essentially any ailment that presented with no obvious external wound. Patients vomited violently, repeatedly, sometimes for hours, while already weakened by whatever illness had brought them to the doctor in the first place. The treatment reliably left patients dehydrated and exhausted regardless of what it did to the underlying condition, and physicians reliably interpreted that exhaustion as evidence the treatment was working exactly as intended. It stayed a first-line prescription for the better part of 2 centuries, prescribed by doctors who never once questioned whether draining a sick body of everything it had left was actually the same thing as healing it. 29. In 1932, Smith, Klein, and French introduced the Benzedrine inhaler, an over-the-counter amphetamine delivery device, initially marketed for nasal congestion. Physicians quickly began prescribing amphetamine tablets far more broadly, for weight loss, for depression, for ordinary fatigue, for housewives who needed the energy to get through an exhausting day, in prescriptions handed out with barely a second thought. During the Second World War, military doctors distributed amphetamines to pilots and soldiers on both sides to fight off exhaustion during extended operations, treating stimulant dependency as an acceptable trade for short-term alertness. Civilian prescribing followed the same casual pattern for decades afterward, producing a slow, widespread dependency problem hiding behind a completely legal prescription pad. It took until the Controlled Substances Act of 1970 for the United States to meaningfully restrict a drug that doctors had, by then, been confidently handing out as an energy booster for nearly 40 straight years. 30. In the early 1990s, doctors began prescribing fenfluramine and phentermine together, two individually approved weight loss drugs combined off-label into what patients and physicians alike started calling fen-phen. Prescriptions exploded through 1992 to 1997. It became one of the most widely prescribed weight loss regimens in American history, endorsed by doctors nationwide as a genuinely effective, well-tolerated option for patients struggling to lose weight through diet alone. Then, in 1997, researchers at the Mayo Clinic identified an alarming pattern among fen-phen patients: unusual damage to the heart valves, along with a related lung condition called pulmonary hypertension, showing up at rates far beyond what should have been possible by chance. The drug was pulled from the market within months of that report. The litigation that followed became one of the largest pharmaceutical settlements in American history, running to roughly $3.75 billion, paid out to patients whose hearts had been quietly reshaped by a diet pill their own doctor had recommended. 31. In 1996, Purdue Pharma launched OxyContin, an extended-release opioid painkiller, and marketed it to physicians with a specific, carefully chosen claim. The slow-release formulation made addiction risk minimal, even for long-term chronic pain patients. The Sackler family's sales force pushed the drug hard, funding physician education programs, incentivizing sales representatives with bonuses tied directly to how many high-dose prescriptions they generated, and leaning on that low addiction claim at every single stop. Internal company documents later surfaced in litigation, showing sales staff had been coached on how to respond when doctors raised addiction concerns, with scripted reassurances designed to keep a hesitant physician writing the prescription anyway. Doctors, trusting the company's own research, prescribed it broadly and confidently for pain that, a decade earlier, would rarely have warranted an opioid at all. Patients discovered, often only after they were already dependent, that the extended-release coating could be crushed, defeating the entire slow-release, low-risk premise the marketing had been built on. What followed over the next 2 decades was one of the deadliest drug crises in American history, implicated in hundreds of thousands of overdose deaths. Purdue Pharma pleaded guilty to federal criminal charges twice, in 2007 and again in 2020. Some things really don't change. A confident pharmaceutical company promised doctors a safer opioid. Instead, it helped author one of the worst public health catastrophes of the last 50 years, complete with the sales bonuses to prove exactly how deliberate the confidence was. Every treatment on this list had the full weight of medical authority standing behind it: framed diplomas, respected titles, a calm and reassuring bedside manner. Somewhere between a Nobel committee handing Igaz Moniz a medal for the ice pick and a drug company assuring physicians that a crushable time-release opioid was basically safe, the pattern never actually moved an inch. So which one on this list made you the angriest? Or which one had you laughing despite yourself even though people actually died from it? Tell us in the comments below. Subscribe if you want the next 31. A confident man in a white coat sold every single cure on this list, and every single one of them had followers.